Okay, I want to call to order the Children's Trust regular board meeting for April the 8th. I want to welcome everybody here, and my first function will be to read this, which is any member of the public wishing to be heard shall come forward to the podium at the appropriate time. I want to call to order the Children's Trust regular board meeting for April the 8th. I want to welcome everybody here, and my first function will be to read this, which is any member of the public wishing to be heard shall come forward to the podium at the appropriate time. I want to call to order the Children's Trust regular board meeting for April the 8th. I want to welcome everybody here, and my first function will be to read this, which is any member of the public wishing to be heard shall come forward to the podium at the appropriate time. I want to call to order the Children's Trust regular board meeting for April the 8th. I want to welcome everybody here, and my first function will be to read this, which is any member of the public wishing to be heard shall come forward to the podium at the appropriate time. I want to call to order the Children's Trust regular board meeting for April the 8th. I want to welcome everybody here, and my first function will be to read this, which is any member of the public wishing to be heard shall come forward to the podium at the appropriate time. I want to call to order the Children's Trust regular board meeting for April the 8th. I want to welcome everybody here, and my first function will be to read this, which is any member of the public wishing to be heard shall come forward to the podium at the appropriate time. I want to call to order the Children's Trust regular board meeting for April the 8th. I want to welcome everybody here, and my first function will be to read this, which is any member of the public wishing to be heard shall come forward to the podium at the appropriate time. Next item will be the proclamation. It's been a long time since. You remember how to do that? You gotta walk up on the podium. Well, I asked.
He's the chair. He can do it anywhere.
I would like to read a proclamation for Child Abuse Prevention Month. Whereas all children deserve to have the safe, stable, nurturing homes and communities they need to foster their healthy growth and development. And whereas in 2023, the number of verified cases of child abuse in Alachua County was 2,123, according to the Florida Department of Children and Families. This rate is among the lowest in the state, but any number above zero is way too high. And whereas research has shown that childhood trauma survivors may experience learning problems, increased use of health and mental health services, increased involvement with the child welfare and juvenile justice systems, and even some long-term health problems. Trauma is a risk factor for nearly all behavioral health and substance abuse disorders. And whereas in Florida, any person is a mandatory reporter if they know or have reasonable cause to suspect that a child is abused, abandoned, or neglected by a parent, legal guardian, caregiver, or any other person responsible for the child's welfare. And whereas effective child abuse preventive strategies succeed because of partnerships created among citizens, human services agencies, schools, faith communities, healthcare providers, civic organizations, law enforcement agencies, and business community. Now, therefore, through the authority vested in me by the Board of Children's Trust of Alachua County, I do hereby proclaim April as Child Abuse Prevention Month and call upon all citizens, Children's Trust partners, community agencies, faith groups, medical facilities, elected leaders, and businesses to increase their participation in our efforts to support families, thereby preventing child abuse and strengthening the communities in which we live. Duly proclaimed this 8th day of April, 2024, attested by the chair of the Children's Trust, Alachua County, Florida. And where might I give this? Who may?
Back to the clerk.
Okay, all right. Okay, I will do that later in the meeting or after the meeting is over. Thank you very much. I know some work went into that, so thank you all very much. Because
I think that might be our first proclamation this year.
This year.
Yeah.
Yes, sir.
All right. I saw the pinwheel, so I thought that was great.
Yes, sir.
Yeah.
Thank you.
that 2,123 is just too much.
Hmm.
Okay, at this point, if there are any general public comments about anything that is on the mind of anybody in the public, this would be the appropriate time to come forward. Ms. Kitchens, how are you today? Doing very well.
Thank you so much for the opportunity to speak with all of you today. I'm Sherry Kitchens. I'm the director of the Child Advocacy Center I really appreciate the proclamation, Child Abuse Prevention Month, and is an important time for this community. And to see so many pinwheel gardens all over town is really encouraging. So I want to thank you and all of the trust providers for participating. I want to share another opportunity for everyone here to help us work on ending childhood sexual abuse. I'm going to be sharing this flyer with all of you. This is a Walk in My Shoes presented by Lauren's Kids Foundation. Senator Lauren Book was a survivor, is a survivor of childhood abuse, sexual abuse at the hands of a female caregiver when she was a child. She has worked tirelessly in her role on the legislature to address statutes and legislation to help protect child abuse victims. And she is going to be coming to Gainesville. She does this Walk in My Shoes every year. She walks from Broward County in the house where she was abused all the way up to the state capitol to raise awareness and empower survivors. And so she's coming to Gainesville on, whoopsies. Everybody okay back there?
Somebody's very excited to hear that.
So she will be in Gainesville on April 19th. The registration for the walk, I'll share this with you. There's a little QR code here to sign up and register. If you'd like to come and walk with us, the walk will start at the Child Advocacy Center. Registration on site will be at 11 o'clock. We will start walking at noon. We will have a little rally in our little parking lot of the Child Advocacy Center at 500 East University Avenue. We'll be walking the first about 3 miles. We'll take a break and then we'll walk an additional 3 miles. The stop point is about halfway for those of us that can't do a full 6 miles, but we'll just encourage you all and encourage the providers that are funded by the Children's Trust to come out and join us, and also invite any survivors or children who have experienced some of this childhood sexual abuse to help them know that it's okay to tell and to feel stronger and supported by Lauren. She really takes some special time with the children who join us on the walk. So thank you for the opportunity to share this with you, and I hope you'll be with us on April 19th. Thank you.
At what time, Cheryl?
The walk starts at noon.
Okay, thanks, Sherry.
Thank you.
Sherry, can you send that to us electronically as well, and we can put it on our social media?
Yes, absolutely. We'll take care of that. I've spoken with Liz about it already. Thank you.
Thank you.
Anyone else? Okay, we'll close the general public comments. And we'll go to new business, and I believe the first item will be Marcia and Mia. Oh, I'm sorry, I tried to skip something very important, which would be the executive director.
Well, it appears that the executive director owes the board an apology, so I will start with that. But some of you went to the other location, the other meaning our building. I apologize for the confusion. For the near future, at least next month's meeting, we will meet here. We have this building reserved because we are not yet done with our renovation. So we will make sure that whatever goes out to you is very clear that we will be here at the health department and not at our 4010. Well, Shane apparently went over there as well. So looks like half of you went to the other building. So my apologies to you all. My report is really short. I don't see the young lady in the room with us as of yet that I wanted to highlight and thank, but I am so excited about the new executive, she's the CEO of the Early Learning Coalition. We've had maybe 4 or 5 meetings with her since she took over. She's only been CEO for about 2 weeks. Out the gate, she has really been on top of everything. She really wants our early learning coalition to help our community's children and family. You're going to hear from Mia in a moment about some of the things that we're going to be doing with them. We are excited And I wanted to publicly just say thank you to her for the work that they are doing, and that she is kickstarting from our ELC to ensure that our children in our community get the early start that they're supposed to be getting, and that our centers, I saw our friend, Mr. Lawrence walk in, that our centers are also going to be reaping the benefits of some of the things that they should have been getting all along. So that was one thing I wanted to say. And then secondly, I wanted to highlight our staff. Our staff work really hard. You know, I kind of get to take credit because people tend to see me and hear me, but I am nothing without them. They are in the quote-unquote trenches. They are doing the work, the hard work of keeping the train moving all along as we go. So I understand, having worked in a support capacity for 14 years, that you often don't get credit, and you certainly often don't get public credit for the work that you do. So I wanted to just say thank you publicly to all of the staff of the Children's Trust for the hours of work that they put in, for the hard work that they do, for the professional excellence that I see them exhibit day in and day out. I wanted you all to know that that is the kind of staff that we have at the Trust. Additionally, these two won't like it, but I'm going to do it anyway. We have two staff that are going to be leaving us. And again, I have said to them privately, thank you for the work that they have done. I have said to them privately that I think they rock. But again, I think it's important that I say it publicly and certainly in front of you all. So Dion Carruthers, thank you for the work you have done here at the Trust. You will be missed. We appreciate you, and we are truly going to miss you. So thank you. And then if you had an opportunity to read my Friday report, you heard that this young lady, our finance director, will be leaving us at the end of the month.
I didn't read it Friday. I didn't read it. I'm catching up.
Tina did not read our Friday report. Diana is moving on to, I'm gonna say better, greater.
Closer.
Closer. Yeah,
Closer.
that's really it,
Say
closer, pastures. And so Diana from.
To the county?
No.
I was like, wait a minute. Now.
Closer to her house. Going to a county.
Oh, I was gonna go get on the timing. I was gonna be like, wait a minute, dude. Now you can't be poaching our people.
From the time she got here.
But we should ask the county if they got some people that we can put.
From the time she got here, which literally was about a month and a half, if that, after I arrived, her temperament, her attitude has been phenomenal. There was a lot that we were dealing with. We were cleaning up. It required, again, long hours. Diana, and there's Miss White walking in the room. Diana took it on, answered all the questions that we had and we didn't have answers. She sought them from county staff. Just, in my opinion, went above and beyond. So this one hurts. Not that Dion's didn't, because that one hurt too. But I truly am going to miss Diana. As you all know, the finances piece of this is huge. She has graciously given us 30 days notice and literally said, Marcia, I will be here for whatever you will need. So we're going to be looking at what our needs are going to be, figuring out a plan. We'll bring that back to you next month. But I wanted to say today, while we were here, thank you, Diana, for the work that you have done. You will be greatly missed, and I truly appreciate having you as a part of it.
So let's give Dion, Diana, and staff a big round.
Yeah. And then Leah, oh, I'm sorry,
I was just gonna make a quick comment.
sir.
Dion, you're one of the originals. You know, you were in the trenches when we built from the ground up. So thank you. I wish you all the best in your next endeavors, and you will be missed in Alachua County. And Diana, I'll never forget, one of the first meetings we have. She called me to the office and she said, we gotta figure out fund balance, and here are my thoughts and my questions. And we spent, I don't know, 2 hours maybe in the office that day, maybe an hour. And, thanks for coming in and really just picking it up and dealing with car rigs and all of the stuff that we had to deal with as a finance director. I wish you well. That's it.
Well, what Ken said, thank you. I wish, well, I hate to see you go, honestly. It's hard to recruit good finance staff, so that was a gut punch. I hate I didn't read the Friday thing, but I got so many emails I'm catching up. It's not that I'm ignoring you, Marcia, it's just trying to get caught up, right? But we wish you well, and we hope that you will stay until we get somebody else.
Stay close to them. Be ready on the phone.
Yeah, stay close.
Will be
God.
question.
So on May 1st, you'll be there at 8:30.
Is it 30 days starting today or what?
No.
Thank
Last
you.
week, retro.
Okay, and Dion, we're gonna miss you also. Hope be in touch.
Lee,
Yes,
if I may, Ms.
You may.
White with ELC just walked in.
Yes.
And I want her to at least raise her hand. I just said a quick thank you to you, and shared with the board that, we are so excited to have your leadership at ELC and excited about the partnership that we have begun to build.
welcome. And she went on a lot longer. So, okay,
Thank you, sir.
sure thing. The next item, Marcia and Mia, I believe, is the investment childcare tuition assistance partnership.
Yes. Get in the PowerPoint.
I believe ELC is involved in that, isn't it?
First time.
Good afternoon.
Good afternoon.
Good afternoon. All right. The purpose of this agenda item is to share about two projects I've been working on. The ARPA Early Learning Discretionary Grant Program, and then of course the Child Care Tuition Assistance Program. Both initiatives align with our strategic priority number 2, children and youth can learn what they need to be successful. As a reminder, the board approved 35% of the CTAC funding to priority number 2 to focus on opportunities like partnering with the Early Learning Coalition to ensure eligible children receive quality care. Slide 2. This program proposes to use an investment funds of $150,000, which creates a local funding category, and I'm calling it Child Care Tuition Assistance Program. And this will allow ALICE families in Alachua County to enter the school readiness program. So ALICE stands for Asset Limited Income Constrained Employed. And ALICE families are those that have earnings above the federal poverty level, but below a basic cost of living threshold. Slide 3. So to enter the school readiness, and if you look at this slide, it shows you the difference between the Child Care Tuition Assistance Partnership that we are creating here and what school readiness actually is. So to enter into the school readiness program, the working families category, family income must be at or below 150% of the federal poverty level. Once a family has been determined eligible for school readiness, families can remain in the program even if their income increases up to 85% of the state median income. So school readiness also includes those families that are recipients of temporary cash assistance, families who are at risk, child abuse, neglect or abandonment, homeless parents, teenage parents, families with children with disabilities and special health care needs, along with parents who are victims of domestic violence and low-income migrant families or farm workers. The Child Care Tuition Assistance Partnership, by creating this partnership, it aligns with the working families category requirements, except for the income limit, and sets the initial eligibility income limit to 200% of the federal poverty level. ELC and the Children's Trust creates a pathway for families to receive needed support who would otherwise not have, they would have not have qualified otherwise. So there is something in the legislative this year, there were lots of bills for early learning, and I'm not going to go through every one of them. None of them passed.
Right.
However,
None of-
however, what they did do is that there were bills that passed and a few of those things were added underneath those bills. And one of them is House Bill 1267, which introduced the School Readiness Plus program. And a child who is determined to be eligible for a school readiness program funds due to family income during the annual eligibility redetermination process is eligible for subsidy under School Readiness Plus if the family income is between 85 to 100% of the state median income. And that's a big deal for what was happening before. But it's important to note the School Readiness Plus program would not benefit the families for the program that we are creating right here. These families currently are in the working family match waitlist, and they would still need to be funded in order to get support. Match funding, and I'm going to talk about that a little bit. So for ESL to be eligible for matching state funds, ESL must match its portion of the state funds with for dollar match of local funds. EOC has formed funding investment partnerships with the city of Gainesville and the city of Newberry. And they can create similar partnerships with other county government, municipalities, employers, charities, foundations, businesses, the list goes on. They can create those. And when they create those partnerships, they can draw down those match dollars from the state and to be able to bring more school readiness slots right here to our community. So it's important to note that the $150,000 that we would be investing would not be matched this time around. But however, as we continue to invest into the fund, those would be. And I'm going to pause before I go to slide
Okay.
4. Go ahead and go to slide 4.
Thank you, Mr. Chair. So Mia, are we limiting, how many kids or families will the 150 cover?
Right now, it would cover right about 60 children.
60. And so and how do you come up with that number?
It's based on the number of kids that are on the wait list. So we worked with ELC and they were able to tell us how many 1-year-olds, 2-year-olds, 4-year-olds, 5-year-olds are on that wait list. And based on that, we know what the cost of those children are and how long they would need that funding. So that's how we know our 150 would stretch towards.
So we're
that
actually
number.
subsidizing the funding for the child, for the family. We're not actually paying for all of the care,
We're paying for all of the care.
paying for all of the care. Okay, and so you get.
They will still have to pay their parent portion. That's
The transition. Right.
So,
Wait,
Yes. Would you come to the mic? Would you come to the mic since there's like the Zoom?
I just want to add, so this funding, what it covers, once they go into our program and we cover for 1 month under this 150, we can move them to another category that would spread out the cost for the rest of the care.
so it's not 12 months of funding. It's a
No.
couple of months until they can transition
To
under
To
your
another program, yes.
And the
so that's
state,
how-
and the state allows for that?
Yes.
Oh, okay. I thought okay, so it's not, I was so how much per month are we talking about for a child? Approximately.
The amounts vary by family, so, one amount that we worked on $156,
Per
per
week.
family,
Per
per
week.
family, that we would cover those 65 children. And then once we cover them for 1 month, we would move them to another category to be able to pay their funding out. They would be able to stick with the program once they got in.
Okay, and then the idea is in this initial year, this is how we'll do it, and then in the following year, this would be matched with
Correct.
ELC funds?
It
Mhm.
will be matched.
Okay.
Because at that point, if we would have done this program earlier on, they could have requested the pool of match dollars that the state actually has for match. So now they're able to budget knowing that there are other organizations like ours that would love to be able to match those funds.
I see. Okay, thank you.
any other questions?
Yeah.
Ms. Hart, Dr. Hart, and then
That just
Mr.
seems really cheap.
No.
It doesn't seem right. Could that possibly be right? For a 0 to 5-year-old, it's got to be more than $256 a month.
No,
She
we,
said per week.
week.
Per
She
week.
said a
Gotcha.
She said a week.
Okay. Yep, gotcha.
Member Surter?
Yes, thank you, Chair Peoples. I had a question. I'm a little bit confused or was trying to tie the 150 investment that we were saying with the $340,000? Are you going to get to that?
Yeah.
Or, okay, all right.
You were the only one.
Chair,
Um, Yes.
are you done with that?
Yeah, that was my
question?
question, and I was going to wait if she was going to cover it, so.
Okay. I wanted to address Ken's point. I think you may have had some, may have been not confused, but, question about this because we had talked about this before and we had been told by fact that there were some, there needed to be some clarity
Mhm.
about whether or not this could be done. And we were told to wait. We had a conversation about this starting last summer into the fall. We were told that there was going to be legislation to address this. There was no legislation, and we were told that it was okay to move forward. Several of our sister trusts have been doing this, but FACT had been researching it and had asked anybody that was preparing to make this kind of infusion into their ELCs to wait until they could get us some more clarity. So we have received it and we've been told we can proceed.
Yeah, I mean, my 2 points would be if they're taking over the funding in month 2 or 3, I see how that's leveraging those initial dollars.
Mhm.
If they're not, then what I'd like to do is not, is see if we could help more families by maybe funding 50% or 25% or 75%
Mhm.
so that we got as many families or as many kids as possible into the system. But what I'm hearing is this was the list that we needed and this kind of covers everybody. Or or is there a way to cover more people?
That covers 65 kids.
Yeah.
This amount covers 65 kids. We currently have 188 that's on the wait list.
So if we did a third per family, not all families could do it, but could we double the number of families and kids?
Possibly, but I don't have the math in front of me to work the numbers out for you exactly.
Yeah, because if you, so that's
And-
really the source of my questioning is if we have a need for 180 kids and we're doing some initial funding and we
Mhm.
said to families, if we covered a third of the cost, can you cover the rest? And they said, yes, then maybe we could cover them all. If they said no, but I could do half, I don't know what that break is. I'm not close to that, but I love that we're trying to help
Mhm.
get these kids going and I want to do as many as,
And Ken, keep in mind the list will continue to grow.
of course.
So, yeah, so that was also we couldn't, we were kept moving because the numbers move. So
One of the,
it's,
one of the things we looked at is exactly what Marcia said, is that the list will continue to grow. But on top of that, we have rising 4- and 5-year-olds who are going to kindergarten. So you're going to have kids that jump off. And I wish I had that number in front of me to tell you how many kids there were on the day that we talked, because list has grown since we started this. It's doubled since we started.
right, it wasn't that many on it when we were.
Right.
Yeah, and one more question and I'll be done. So in the recommendation, can we give you the flexibility to go back and see
Sure.
how can we maximize the number of kids as long as we kind of earmark that funding, ask staff to work with the OC to kind of maximize those kids, if that's the will of the board? Or is this something that you've already programmed and you know what you're doing and you've already talked to the 60 families?
I'll take the recommendation.
Is that something that would be
It
helpful?
sounds like something that definitely would help.
Okay, well, I want to
We
hear
just want to
from,
be able to help families and help as many as we
Of course.
can.
yeah, okay. I want to hear from my colleagues in the public, but that's kind of my thought
Mhm.
on how we could maximize.
Anyone else?
I do have.
Yes.
Could you explain the one piece of legislation you just referenced that they're not eligible for this funding, but what was that?
It's called School Readiness Plus program.
Okay.
And one of the things I probably will say in the next presentation is that we're still seeking guidance on all the appropriation stuff
Mhm.
as well as the legislation as to what exactly it all means. As we learn about it, we'll be able to share more with the board. But School Readiness Plus was a program that came right underneath the House Bill 1267. And basically what it allows for is when those families come out of that 85% state median and they're at 85.1, all the way up to 100% of the state median, they would qualify for school readiness. And it's to help,
The fiscal cliff.
Mm-hmm,
Mhm.
mm-hmm.
more so to me, the childcare fiscal cliff.
Well, that's, yeah.
Because
Family.
this legislation really did not address at least that, because we know that minimum wage is going to go up this year too, and more of those families are going to need that school readiness because of that. Because they won't, otherwise they would fall off. So you're right about that part.
Thank you.
Member Sorton, did you have a question?
No, no. I'm
Um,
gonna wait until she get to that part.
Ms.
Chair
Jones?
Hickerson, you have a public.
I have a question. I have one question before we get to the public. Um, Mia,
Mhm.
the, when we can match it, does that mean that we will get double the number of children off the list when ELC can match it?
To me, it means that we can support more children, but yes, we'd be able to get more kids off the list.
Okay, all right. And to Ken's point, y'all will go back because you said we're funding 100% of it. If, y'all can get the data somewhere to see whether or not the families can help, or that be, a phone call,
Yes.
can y'all pay something?
Absolutely.
Okay.
And a part of this, remember, part of the match funding program is that one of the things that Ms. White is doing is also bringing in more partners. So she's already brought in the city of Newberry, the city of Gainesville has been doing it for several years now. And so as she's able to meet with more municipalities, even coming to the county, more businesses, that's more money to, go into that funding to support children who would need school readiness.
Okay, and before we get the public input, you want to put out a motion?
Well, I was gonna, do staff's recommendation and ask that they go back and try to maximize the number of families and kids that could be met under this program.
Okay.
But we haven't gotten to 340 yet.
Well, they're two different things, so let's do the 150 first.
Okay.
So we have
So
a
I can
motion.
second that.
We have a second, okay. Dr. Knopf, did you have a comment?
To- to-
You want to come up?
come to the mic.
Well, I think that before you guys implement this, you want to make sure that you get clear guidance from the Division of Early Learning, that state statute and rules governing this swap is doable. My understanding is that there are several coalitions that talked about doing this in previous years, and they reviewed the rules and determined that to switch from this funding source, this privately funding program, to a BGA category, the parent would have to re-go through initial eligibility. And when they go through initial eligibility, if their income is above 150% of the federal poverty line, they're not eligible for the SR program. And so just switching their billing code is not permissible. If they come in under this one, under 200%, but above 150, switching them over to BG8 a month later is not permissible because they would still have to go through initial eligibility for SR. So I think that if that's what we're planning to do, cover them under this program for a month and then swap them to SR, we need to get in writing documentation from DEL that that's permissible. They have been investigating other coalitions to confirm they're not doing that with some of the money that they've been receiving from trusts, because that would be a violation of state rule and statute to fund them if the family is made after initial eligibility above 150% of FPL. So that's just one thing that you
But
guys
they
need to make
wouldn't
sure that you
do
get
that.
really documented well,
And if you
or the
can't afford
coalition's going to be
childcare,
in trouble.
get
Now you guys are
BCF
putting the
case.
initial
See, it's so
funding out there.
vicious. It keeps
You wanna
certain
include
people
that?
One
in
thing
jobs.
that, I can comment on that, one of the things that we did do is have our Early Learning Coalition of Alachua County do just that.
Yeah.
They reached out to other coalitions and they reached out to the Department of Early Learning. However, since Ms. White is now starting, she can talk with her staff just to make sure that they did the proper steps. And we did see the documentation.
Okay, but you'll include that in the
Yes,
motion.
I could just add to the motion. Well, is there anyone else? Any
Is
other
there-
public?
Anyone else like to speak to the motion? Okay, back to the board.
Yes, I would just add to the motion that we make sure that we get the proper documentation from DEL and the Early Learning Coalition on the program, on the eligibility of the program.
Tina, you good with that?
Yes, I am.
All right.
Yeah,
Any-
because we don't want to have to pay back any money. We don't
Yeah.
need
Yeah,
auditors
we
coming
don't-
down.
We don't want the publicity either.
Yeah.
so,
And I
Um,
want to clarify one thing, and I
yes.
ask this every time. I serve on the ELC board and I'm on their executive committee. Am I in conflict to vote on this? You usually say no, but I always ask. I'm an ELC board member and I'm on their executive.
No, you don't have
It's
a
not a
Okay.
personal conflict.
I just ask every
You
time.
just have a lot of power.
A lot of power, so.
You're very powerful.
Okay,
Like, late.
with that, all those in favor of the motion say aye.
Aye.
Those opposed, the motion is unanimous. Mia, the next part,
Okay.
the
so
donation for the other thing.
The second one, initiative would allow the Children's Trust to reinvest more dollars back into the community and support participating early learning businesses in greater capacity. So let me first tell you what ARPA, Early Learning Discretionary Grant Program is. Recognizing that childcare is essential to supporting children, families, businesses, and the economy as a whole, the Federal Office of Child Care provided funding through the American Rescue Plan Act, ARPA, Discretionary Child Care and Development Block Grant Trust Fund. I believe this is the final grant under that initiative. Each ELC created a proposal and submitted a plan and the cost for that plan to the Division of Early Learning. So I learned about this last year, and the board challenged the staff to find grants and investments that would continue to expand our ability to invest more dollars in the community. So I spoke with the former CEO of Early Learning Coalition and asked if we could add to her ARPA application to the Division of Early Learning. And after determining if it even qualified, if it met any of the requirements, she said yes. So the Early Learning applied in September of last year and was awarded 4.5 million, and that must be spent by June 30th of 2024. And from that
Wow.
request, do I need to pause?
That's like soon.
Yes. From that request, the following was approved. The cost of, so you'll see it on the chart here, the cost of our masterclass in the Accreditation Academy, and that's the 295,000. The Velocity Masterclass participant stipends, which is an investment of 24,000. The Accreditation Academy business stipends, which is an investment of 21,000, and 20% gold seal, an investment of 10,564 and 35 cents. So when I initially submitted this to all of you, I think I said 340,000, but working with Ms. White and her staff, we initially were not going to be able to support the third one, the 20% gold seal, but they were able to go back and we were able to support that fourth approval. And so the total amount is actually $350,564.35. So I am asking for approval to approve the recommendation to accept the Early Learning Coalition of Alachua County's investment funds in the amount of $350,564.35, and asking to approve the recommendation to contract with the Early Learning Coalition for Alachua County for the creation of the Child Care Tuition Assistance Program, which would funding category and provide an initial investment of $150 for the program. And then, of course, the third, I believe that you've kind of slightly changed it, but the trust is asking to approve the recommendation to provide additional future funding investment to the Child Care Tuition Assistance Program as determined by staff in order to sustain the funding category with the Early Learning Coalition of Alachua County.
Any questions before we get?
Yes.
Okay, Member Cerna?
So, thank you, Chair Pinkerton. Mia, is the, so I get the 350, understood, but so is this 150 that you mentioned, is that an additional 150? Or is that the same 150 we just talked
So
about?
it's the same 150 we talked about. So it's
Okay.
two different programs. One has to do with match funding, in investing 150. The second one, and that's giving them money. The second program, that $350 is receiving money from the ARPA Early Learning Discretionary Grant Fund.
So, this masterclass accreditation and all of that, will that be conducted in enough time to be able to spend down by June 30th? Or are we
Yes.
going to pay back
It's
what's already been done?
what's already been done. So, we started Masterclass and Accreditation Academy in October, with the recruitment and the, all the other parts that come with it. And their last class is in April.
Oh, so you can use this money for that,
Yep.
even though that, oh, okay.
So really what happened is that, of course, former CEO and then the staff had to figure out when I checked in on what had been approved, and we were able to find out that, yes, it had been approved, and this is for how much it was approved.
Oh, okay.
Great.
Well, that's like a gift to us.
Yeah, thank you.
Yeah,
Any other questions?
I move staff recommendation.
second.
Is that enough, Mia?
The two things you just read,
Yes.
1 and 3,
Yeah,
Changing
because the 150's
And
already been
changing,
done.
right.
changing one from 340 to 350, 560. And
Yes.
some pennies.
That's
Okay.
it.
Any further discussion of the board? Any discussion from the public? There being none, all those in favor of the motion say aye.
Aye.
Those opposed, motion's unanimous.
That's why it's getting on our good side in our first meeting, giving us a bunch of money. Now I understand all the accolades. Thank you.
So that we'd already budgeted for the master plan, you know, master, so that would free up whatever money we budgeted, right? Okay.
Yeah.
Now, I do have one question about the Gold Star. That additional money, we said it would, at some point, if they pass the class,
Mhm.
they can get draw down additional dollars. Is that from the state or is that just from us?
No, that's from the state.
Okay, so this is, in addition to,
So this is, what are we calling it? This is to prepare them for what that will look like once they are able to start
Okay.
drawing down those funds.
okay,
Yes. So one of the things that we learned from other BLI and early learning coalitions, whoever does a BLI class, is that that's one of the incentives that they do. So as they are working through the program so that they can feel what it means to have those extra dollars coming in and be able to, really be able to start working towards their business plan, that's what that is. So
Okay. okay, great.
Can I ask a
Yeah.
question?
Yeah.
It may be an obvious question, but so the second part of the motion that we just approved, did we just approve it? Did we vote on it?
Yes.
Yeah, okay.
Yeah.
Was the seeking future, we're making investment now, they're gonna come in and match it in the future years. 150,000. Is there a reason why you came up with 150,000, even though they just gave us 350,000?
I'll have
That's
to
for
pass
different-
that question
That's
over
not the
to.
same 300.
The 150,000 is what we budgeted when we had our program workshop meeting.
Did we budget the $350,556 gift?
No,
No.
that was
So,
once we
Yeah.
learned that they could apply for those dollars. That is when Mia started
So
working
you-
with the.
So you want to
former-
put the 350 in the pot is what it
It's not
sounds.
350, but
Or some
100,
more.
if we
not?
put another
Why not?
150 more, why wouldn't we do that with ELC?
Why don't
Is
we
it-
send it
Why
to
not all
staff,
of it?
since we have the money, but, you know,
I mean, I would
Mhm.
move that we ask staff to look at that and bring back a recommendation, because it would seem like
Mhm.
when our partners are helping us and we now have basically fund balance and we have a huge need
Mhm.
that maybe you can bring back a recommendation to double that in the next meeting.
Absolutely. I can do that.
Or more.
Or what?
Or more.
I heard 180 kids. Maybe there's more. I don't know. Is
Work down that list.
Yeah.
That way.
Love it.
that okay?
Mhm.
So that's my motion. So we refer that back to staff to bring back to us at our next.
wasn't that kind of included? Because you said to look for staff to look for, that was part of the original
Yeah, that was
motion that
already
we.
done.
Well, it's
we approved.
maximizing 150. Now it's, just got 350. That's not budgeted for, so.
What I
let's
thought
put
I
that to
heard
use
was
for that
other
one.
opportunities, funding opportunities,
Yeah.
which would be a catch-all for that.
It would. And my only point is that when ELC brings us a gift and they have a huge need, why wouldn't our first look be back?
That's fine. You have a motion. Do we get a second? Okay, we have a second. Any discussion? Any public discussion?
So Ken, that money didn't come from LC, that's ARPA money.
I understand.
Okay.
Through
Yeah.
ELC, through ELC.
Through LC.
County gets lots of ARPA money too, and we
I
try to
know.
leverage that with our
Right.
partners. And so I haven't seen a partner bring us. I mean, literally haven't seen it. Has it happened anywhere else in this county? We've gotten ARPA money from so thank Ms. White, thank you. And
Okay,
I would just add that those funds end June
one-time
30,
funds.
right?
Yeah, they're one-time
Right.
funds. Yep.
so, all those in favor of the motion say aye.
Uh,
Those opposed, motion's unanimous.
Let staff work up, one-time money. I hear you.
Ms. Chan, did you?
No,
okay.
no.
Thank you.
But I was as testimony for the need for flexibility when you're talking about other partners coming in and you don't know if they're going to come in or not come in. You also don't know if somebody else is going to discover that in their spend down plan that they have ARP money. I assume there could be other money that comes. So in the next few months. So just, I echo the need for flexibility and maximizing this one-time opportunity.
You mean like, and somebody else may have a lot of money that they need to spend down by the date is what you're saying,
Correct,
the,
yeah.
the deadline, I mean,
Could happen.
that could be good.
Would have to be by the next meeting if it's June.
But if, I think Mary is asking for for staff to have the
Yeah.
flexibility to be able to do
And
it.
it has to be spent or it has to be obligated or encumbered.
It has to be spent.
Okay, thank you very much, ma'am. Next item would be Ms. Wagner for the continuous quality improvement.
In previous board meetings, I presented on program results, outcomes, effectiveness, discussed our efforts and processes for monitoring and to support quality. We are in our second year of implementing a continuous quality improvement or CQI process at the Children's Trust. Today, I wanted to provide an update on how we've been continuing to develop our CQI process and what we are learning. The objectives for this presentation are to revisit the purpose and vision for continuous quality improvement, to provide an explanation of the tool and process, to highlight what's new and improved, and to share this year's results and some insights. CQI is an ongoing intentional process for learning and driving improvements that will enable us to achieve better outcomes for children and families. Next slide. Our vision for CQI is to intentionally review our shared goals, our expectations, and to bring the results all together and offer an opportunity to talk about it. Through this process, we are able to learn about the challenges providers are experiencing and determine action steps. It's a framework for us to examine our work with providers consistently across the board. This process also allows us to better understand how to support organizations as a whole and determine the effectiveness of our expectations and processes. CQI will help us build a better, more efficient system for serving children, increases visibility and transparency into areas of program success. It's a communication tool that provides an opportunity for us to revisit and clarify expectations. It reflects on both accomplishments as well as challenges and prompts us to collaboratively plan and identify ways to improve moving forward. It helps us as a funder to identify and address systematic challenges, better support our providers, with the goal being to learn, grow, and thrive. While it does serve the purpose of giving providers notice on when they're not meeting expectations, the intention is to support learning and to give an opportunity for providers to receive support and make corrections. So on the next slide, we have our CQI tool and the components and items that make up the tool. There's 6 components. They include fiscal, operations, population focus, service delivery, and performance measures and data quality. The primary staff involved in the rating process are listed on the right column. And then greater detail on each of the component definitions is on page 2 and 3 of the provider CQI tool that you received in the board packet. And for fiscal, but quickly run through that, for fiscal is CQI rating is based on the utilization of the funding allocation. For operations, we examine the provider communication and acknowledgement of funding. For population focus, we look to see whether the program is serving the intended population as defined in the contract. And for service delivery, we look at the program, whether it's being implemented with quality and according to contract specifications. These ratings are based on site visits and observed documentation. For performance measures, as you know, all providers have performance measures. And last year, we revised how the rating assesses whether they're mastering, advancing, emerging. So providers that meet all their performance measures are rated as mastering. Advancing is whether they've met 80 to 99% of performance measures, and emerging is when they have met less than 80% of their measures. Last but not least is data quality, where we know whether their data was submitted on time, whether it was complete and accurate. Next page shows a screenshot of page 1 of the CQI report that providers receive. The top portion goes over the name and description, the year funded since, and to the right is the program scorecard with the 6 components I just went over, and it tells the provider where they landed on the rating scale, with mastering generally indicating exceptional performance. They did very well. Advancing generally means good, they're meeting their contract requirements, and emerging means that things need improvement or things didn't go as planned. Below that is the results summary. So that middle section of page 1 goes over how they did in the different areas for fiscal, operations, data quality. It will show them all their performance measures. The gray bars indicate the target. The blue bars indicated their actuals towards those targets. And then below that is the feedback from CTAC staff. So those are our comments, narrative comments. This was expanded upon from last year, but definitely any area that was noted as yellow or emerging, we'll give additional narrative as to why that rating was given. And any other comments or feedback we'll put into that section. Page 2 of the CQI report gives an overview of the purpose of the tool, and it gets into the nitty-gritty of the definitions of each item and component. And then the color rating received will be indicated by the corresponding color versus a gray. So the provider could see how they did on page 2 as well as alongside the definition. So in the example, use of funding allocation, this one, this example shows advancing. For communication, funding acknowledgement, target population, and service delivery all corresponds with specific definitions with what is in their specific contract definition. So these are things that are included in the contract that folks should be familiar with, but this is an opportunity to revisit what they are and give feedback on how well they were achieved. The last page of the CQI report goes over performance measures and data quality definition. And the last section, the provider reflection. Annually, providers complete a program reflection survey where they give a narrative feedback on successes, accomplishments, notable challenges in meeting program goals, and areas for opportunity. So the providers' responses to the notable challenges and the areas of opportunity are included in this report, so we can kind of see it as a combined package where we give our feedback, but also their feedback's included, because this often tells us the why. If they did have an emerging, they might say, this was why, this was some of the things we encountered. So it's takes a more complete look. These reports are emailed out to providers for review. Providers are asked to take notice of any area that are marked as emerging as well. And as these will be areas we'll be looking to see that there's some action taken and a plan for improvement. The reports are reviewed during the contract negotiation process, and we also offer providers the opportunity to reach out and meet with us at any time to discuss these results. Okay, so the next slide is our overall results. This shows the roll-up of CQI into overall results and tells us areas of strength and opportunity across all our funded providers. In total, this includes 59 programs and 45 organizations. And moving left to right, we made 6.5 million in programmatic awards. 5.2 million was leveraged at 79% utilization. This is 3% higher than in the previous year, where we had a 76% utilization. And in terms of our CQI components, contracts were most successful in population focused, followed by service delivery, and then fiscal allocation usage. The areas of opportunity remain for performance measures and data quality. And again, this is why I wanted to start this process and start looking at this more intentionally. The achievement of the performance measures were heavily reliant on staffing, which was a notable challenge that is identified by at least 14 programs during the fiscal year 2023 in their provider reflections. Difficulty hiring and retaining staff affected the numbers of children or how much outcomes. amount of programming and participant engagement. Staffing was certainly not the only challenge, but was the one that came up the most frequently. They couldn't meet their numbers because they couldn't hire staff or because staff left the program. Data quality was also impacted by staff turnover and not having dedicated time for data. But I believe revisiting these data in CQI and having this communication process will drive us to improve in this area. We're also in our first year of SAMUS, as you know. And while it hasn't been without growing pains, I think providers are getting used to the process, and I'm working to leverage the system efficiencies and automations to minimize some of the manual efforts. So reinforcing that where people are and sharing the reports seems to emphasize where things need to improve. And these are the reasons why we do CQI, so providers see that we are using the data, and we plan to revisit and discuss how we can achieve these goals and better serve children. So on our next slide compares this year's CQI with last year's. In fiscal, definitely we've seen less emerging and more growth in the advancing area. With operations, more providers are landing in that mastering category and slightly less in emerging. Performance measures looks like there was a big shift, but really the definition changed because what we learned in that first year is a lot of them were falling into emerging, and that's because in that first year we wanted all, it was defined as all providers must meet all measures to get into advancing and mastering, and that just wasn't happening. So that was something that as we went back and we revisited it, we might have set the bar too high in that first year. So we made mastering 100%, advancing 99 to 80, and emerging less than 80, because it just seemed that the bar was set too high when they had a staff vacancy and they were just a few children below the target, they would end up in emerging, and that the process wasn't intended to be that way. So that was changed to equate, and looking at it in the same way, it would end up being about the same as last year. Population focus, we definitely saw more mastering, more familiarity, more reinforcement and monitoring of the guidelines. So that one went way up, and it's actually one of the highest, the best areas of our CQI performance. And then service delivery and data quality are also about the same. On our next slide, we have provider feedback. So in the provider reflection process, we also open the opportunity to have them give feedback to the trust on our processes and their relationship with us, whether they felt listened to. So on this slide, it displays those results. Providers are most satisfied with our wonderful contract managers. They're least satisfied with the invoicing process and data collection, and they feel most listened to by their contract managers. But overall, I thought these results were pretty good. Less than mostly 95% agreement or satisfaction with that. On the next slide, there was an overall question. We asked provider to express their agreement with their satisfaction with the Children's Trust. 94% either strongly agreed or agreed. Some narrative feedback we got is really wanting improvement in the fiscal area and ongoing funding, and in order to affect sustained change, and some requests for more collaborative meetings to serve as a connector was other feedback that we received. So what we do as a staff internally, we review these results and we talk about ways that we can improve and review specific comments that we received from this process. The last slide goes over the CQI timeline and the phases. So at October, all of our year-end data is available, and January, the idea is that programs will receive their CQI reports, because by that time, all the books will be closed. Fiscally, we'll have opportunities to do the ratings, and then February through June would be that opportunity to this year and have discussions with July and September, getting the contracts in place and actions to support improvements. What I discovered is that I did this for all programs were on this cycle, but there are some programs that are on a slightly different cycle, like school year cycle, school year programs. So I think one of the key things as I was sending it out, it felt too late for some providers. So I think I'm going to, in future years, have this be driven by the contract timeline. So, but this would be the general timeline for most of the providers. My last slide is my key insights and CCRI results. So the first one I already mentioned, that the timing moving forward, I'd like to improve the timing for some programs, have it be based on their specific start and end dates. Hiring and retaining staffs being a key challenge. That was an insight that really seeing a lot of the performance measures and a lot of in the provider reflections, that being noted as a key challenge. And generally the process is working as intended. A lot of providers, it prompted discussions and us to talk about things and changes to be made and just ahas to happen to know what needed to happen to make the services improved for families. That's it. Any questions for me on CQI or anything I shared?
Questions, anyone?
I was just gonna say it is simply complex, but it's, I really like, how you have made something so complex, really, simple to review and simple to get feedback and to identify quickly where either provider or we as a trust should be focusing improvement. So Bonnie, great job.
Anyone else?
Keep improving it.
Next year is going to be very important. You know, the numbers I'm not really going to say much about yet. But then next time, it's, to me, it makes a difference, especially the data and the performance measures. I think those are key to the next iteration of the Children's Trust. So, but, you know, and you've given some reasons why, but, and hopefully Samus will make a difference. But watch out next year. Dr. Hart.
I just have a quick one. I've been here long enough to remember when the providers hated our guts, and I think you've done a tremendous job of turning that around. Good job.
Kudos to you,
I mean, really. I don't think they hate us anymore. The contract managers have been working very hard on
They
that.
have.
Good job, everybody.
Yes, ma'am.
While increasing accountability.
Yeah.
Oh, yeah.
But I just wondered where the performance measures changed year over year, if it might help if you've moved the bar to have an asterisk and explain, just like if somebody talking about their report and they're sending it out maybe to their boards to explain that the bar moved, be helpful, quick asterisk.
Thank you, Member Jones. Anyone else? Do we need a motion to accept the report? Okay. All right. Thank you very much. We
Very
appreciate it,
cool.
Bonnie.
Citizen input? Citizen?
Any citizen input? Thank you. Okay. All right. Next item would be the Youth Health RFP. And who will be doing that?
Christy.
Christy.
I better use this. Can you hear me?
Chris, before you get started, I just want the people that were at the workshop, I really felt, and for the people that weren't, I really felt that that was one of our better meetings. I mean, it was my opinion. Everybody was on the same page. And it was, I thought it was a very good meeting.
Yeah. Got a lot done.
Thank Chris.
You're welcome. So the Youth Health RFP, what you'll find in your board packet is a presentation very similar to what was discussed at the board workshop, as well as the scope. And so my goal today is to just review quickly what is different since our board workshop. I too felt that the workshop works really well. We're no longer coming to a board member to introduce the RFP to you all. The purpose of the workshop is to introduce it there, get your feedback, make those changes so that we can then release the RFP. But the workshop was held March 25th. And so those are the changes that we have implemented. As a reminder, there were several data sets and feedback opportunities from families, providers, and the community, and we were able to incorporate that into what was introduced to the board. So the goal of this RFP is to expand access to quality healthcare services for children and youth of families who are residents of Alachua County. There are 3 areas that we're looking to cover: dental care and education, increasing access to healthcare services in rural communities via mobile health clinics, as well as rural healthcare providers, and then funding existing wellness and healthcare navigator programs. I added the image of our SAMIS on this slide, just as a reminder that our applications are going live in SAMIS. And so we're very excited about that. Executive Director Kiner talked about the work of the staff here at the trust, and we are really working very hard and being very diligent about ensuring that everyone has access to SAMIS and will be able to apply for the application within SAMIS. Similar to all of our other RFPs, there's a timeline. It'll be released this Thursday is our goal. Cone of Silence goes into effect immediately then. We will always have bidders conferences. Those bidders conferences are to review the application, to train them on how to apply, how you get into SAMIS, what it is going to look like, the purpose and the requirements of the RFP. We will hold office hours as well. Applicants will, or potential applicants will have the opportunity to come sit with us and ensure that they have the right access, the right information. It's technical assistance. It is not an opportunity to help you with your proposal, but to ensure that you have all the necessary access to submit a quality application. And even if they don't attend office hours, there's an opportunity to ask questions through our SAMIS system. Our review period is the same we are including interviews. We thought this was a great opportunity, provider presentations that potential applicants, those that score within a certain range, we are going to require that they conduct a provider presentation, give us the review team an opportunity to learn more, get those additional questions as a part of that review process. And then like every other RFP, we'll come back to the board with our recommendation. Cone of Silence ends then. Chair Pekinson?
Yeah, I don't see it right now. But anyway, it said the Cone of Silence, oh, here it is. End of Cone of Silence, August the 12th. And then it says that, that our board meeting said something about, I want to make sure that the Cone of Silence doesn't end before our board meeting. That it extends up, but it will not inhibit if somebody wants to say something at the board meeting, that it's okay.
Yes.
That it doesn't hurt them in any way as far as their applications. But I just what I'm trying to do is make sure that there's that the Cone of Silence extends to the meeting so that there won't be contact with board members until that meeting and not prior to.
We can add a time to that section of the timeline that says Cone of Silence ends April 12th, 4 p.m.
Okay. Or, if you just want to put it at, Cone of Silence
Beginning of the
ends
board.
at the beginning of the board meeting. And that way, if you change the time, that's okay. Does anybody have a problem with that?
No, I agree.
Okay, thank you, Kristen.
You're welcome. The minimum qualifications for this RFP services must take place in our county. They must be currently qualified to conduct business in the state of Florida, can't fall under the jurisdiction of the public school system, and must previously or currently have the structure in place to support the proposed program. So the the allocation for this solicitation is $600,000. The term of service falls within our fiscal year, starting October 1, ending September 30, with 2 additional opportunities for renewal. So a full 3-year proposal. Going back to the components of the RFP, youth, dental care and education, we made no changes from the workshop. It is pediatric dental care, ages 1 to 18, community-based, non-traditional and traditional service hours to ensure families have the opportunity to get the care outside of their work hours, and ensuring that a community health worker model is implemented within the dental care component. We also have the healthcare services in the rural communities. Again, that is for mobile health clinics as well as rural healthcare providers. This is one of the things we talked about. I want to make sure that I bring this up. We talked about in the workshop ensuring that we included those healthcare providers implementing a sliding scale fee that matched the Medicaid sliding fee. We talked about requiring them to describe their community engagement and including a description of how they would work the community healthcare or health worker model into their proposal. Again, we are partnering and have built a relationship with the county health department and the staff that is implementing the community health worker model. They have provided us with their model that will be a resource for potential applicants that they'll be able to find in SAMIS. And then we have the wellness and healthcare navigator component. This component was created to fund existing wellness and community health programs. The purpose of that is to ensure that these are programs that are designed to specifically address healthcare issues. They need to be in existence. They need to be already offering this program, and it is designed solely for that purpose. We've also included within the scope, as well as the slides, the evaluation criteria, information. The top 3 applicants from each initiative will move to phase 2. We are offering bonus points. We talked about bonus points specifically for the rural areas that we wanted to target, and that's Archer, Hawthorne, Waldo. And then we also included additional 5 bonus points for proposals that included community collaboration. Phase 2 of this process includes those provider presentations, which is 0 to 10 points, and then funding will be awarded to the highest providers with the highest score, and the award amount and final awards will be contingent upon what funding we have as well as contract negotiation.
Chrissy, Lee, can I ask a question? I don't have my packet from the workshop, so I can't remember, but I was going to ask, we didn't, Alachua and Micanopy, no bonus points for them? I know we had that little grid that had the economic indicators for the municipalities, so I was just wondering.
Tina, by far and away, the worst were.
I know Hawthorne and
Waldo and Archer. They were.
Hawthorne.
Yeah, Hawthorne,
Waldo,
Archer,
Waldo.
and Waldo.
Okay. Okay.
Those were the 3 at the workshop that
Those
the
are the 3?
discussion
Okay.
was that those are the 3 that
I knew
would
those
get
they
the
were. I
bonus
just wasn't
points.
sure about, I can't recall the other cities and I don't have it in my thing here.
Yeah,
Okay,
okay.
thank you.
You're welcome. Submission instructions, this is something we always include, just an opportunity to try to help potential applicants as much as possible, make sure that they are providing all the necessary information for a complete and successful submission. SAMIS also does this for them, where it outlines all of their requirements. It informs them if they are missing or didn't complete sections of the application. And so we're really excited about that, but I wanted to include this as well. And then our final recommendations, we're asking the board to approve Resolution 2024-02 and the release of the RFP, asking for authorization for it to be $600,000, which we did include in the budget when we created our budget for fiscal year 24, and then giving Executive Director Kiner authorization to appoint a review team for the RFP.
Question.
With staff
Mm.
recommend-
I have just one question.
Chance.
Thank you. Christy, on page, oh, it's the minimum qualifications at the front. I think it's 95 in a packet, but I think I heard you say one thing, but it says something slightly different. Cannot be a charter school approved by any public school system in the state of Florida, but I thought you said cannot be a school district or a charter school.
What I hope I said
But I could've
is
heard-
that they cannot be a charter school, cannot fall under the jurisdiction of our public school system.
See, the
I'll
public
turn
schools
to our
are being
attorney
included.
for him to correct that language if I'm not saying it correctly.
That's correct.
Okay.
So it cannot be a charter school or fall under the jurisdiction?
Technically, it's a charter school falls under the jurisdiction. So you don't, we mentioned charter school because early on, we got lots of requests from charter schools. So we call them out just to be specific. But a charter school is under the jurisdiction of the public school system. So we cannot support them.
That's part of
Okay.
the referendum.
Okay.
Dr. Hart?
So just to clarify, if someone were to propose to be in partnership with a school, like to bring their mobile facility to a school to deliver services, the money would go to the mobile facility, not
Yeah.
to the school. That
Correct.
would not be precluded.
Right,
correct?
that's not
Okay, that's the delivery.
precluded.
That is
Right.
correct. We currently have several funders that are partnering, and we encourage collaboration. And so we are always working with organizations that can partner with our school district.
And we're giving additional points for collaboration in this RFP just for that specific reason.
I mean, I'm just saying, if you wanted me to apply for funding to deliver healthcare to children, I'd be going to a school and saying, can we
Yeah.
do it there?
But the referendum, I mean,
Right,
the
I get it. The
statute doesn't
money
allow
can't
you-
go
yeah,
to the
it doesn't
school, right.
allow you
Got
to
it.
give it to the public school system, and charter schools are public.
And then
public-
one other quick question, it's $600,000 for year one, but you're anticipating this might be a 3-year contract. So are we going to be able to come up with another 600 and another 600?
For the next 2 fiscal years after fiscal year, yes, we are budgeting it for each year, $600 for each year.
With a caveat that, salaries can be increased and stuff like that. if we first grade.
Each year, we have increased funding amounts to address the increase in.
Any further questions?
Can I ask one more? Sorry.
that's
And,
fine.
and I'm really sorry I wasn't at this workshop. I must have been just dead. But,
Well, you've
If-
recovered very well.
thank you. I'm back on my feet. I'm just, if I had been there, I would have said that mental and dental are our 2 biggest gaps. So how, are these providers going to be able to address mental health issues for children in some way?
So this RFP does not. What we talked about at the workshop is we just feel that mental health as well as behavioral health issues deserve its own RFP. And we wanted to be intentional about creating something that solely focused on that and didn't need to share the pot of money. And so we are working on figuring out what that looks like. We're also serving on a few different committees with the county, with the school district, along with the community foundation, because we're all currently funding mental health programming now. And so we're looking at the gaps to determine what type of funding and what the services need to be. So we are funding it, as well as some of our other partners are funding it, and we're all working together to make a determination about what should be next in our county.
Really? No, don't apologize. Just for, y'all's edification, I had discussion with Christie and Marcia earlier about on page 109. There's some outcome sought, and my concern was the outcome sought, may end up negatively impacting some of the providers, because I thought that, the program might be good, but it's may or may not have the ultimate goal that we're seeking. So they understand my concern. They've explained something to me about that ultimately this is what they're looking for, not necessarily from each individual provider. Because, you know, say it's a wellness van that goes out to, out to Archer, I don't believe that that's going to be the source, the payer source for healthcare. But it definitely will help, help the problem as it exists. So anyway, they said that it would not have negatively impact the providers as they go through with their RFP process. So anyway, with that, did we get a second?
Yeah,
Yes,
I did one motion.
Okay.
I did, yeah.
Okay.
He said what was staff recommendation and I said.
Yes.
Second, if
Um, any further input? Any input from the public? Okay, all those in favor of the motion say aye.
Aye.
Motion opposed? Nobody's opposed. It's unanimous. Thank you, Ashley. The next item would be, the Gainesville for All presentation, and you said, Executive Director, you
Yes.
said that was a 15-minute presentation. Is that correct?
Yes, sir.
Okay, all right. Mr. Lawrence, the show is yours. And welcome.
Actually, Mr. Lawrence, I think Mia was gonna do an intro
Oh, okay,
and then we'll bring you up.
okay. I apologize. In that case, here's Mia.
Hello again. I think it's been about a little less than a year since Gainesville All came to talk about Gainesville Empowerment Zone Family Learning Center. So they're coming back to talk about their progress. So I'm gonna do an introduction and bring Mr. Lawrence up to, give us the highlights of of his progress report. So the Gainesville Empowerment Zone Family Learning Center, and you might hear me say GEZ because it's a little easier to say, is a joint project by the Gainesville for All and the Alachua County Public School District located on the property of Metcalf Elementary School. One of the missions of the Gainesville Empowerment Zone Family Learning Center is to empower children and families from 6 weeks to age 5 with tools that will enhance their lives by providing them with high-quality educational foundation and connections to vital social and community services. In June of 2023, GEZ was licensed by the Department of Children and Families and for a capacity of 128 children, and shortly afterwards, they became certified with the Early Learning Coalition of Alachua County. As of this report, they have a team of 11 teachers and teacher assistants serving, and this is a correction to the staff report, 39 enrolled children. They anticipate enrollment of 5 more children in the month of April and 12 to 15 more children during the summer. As of March 22 of the 39 children are currently on full or partial GEZ scholarships. Although grants from Alachua County and the city of Gainesville are expected to be depleted by June 2024, they do have an operating budget for the remainder of the year in the amount of $952,000. In this attached report, and you should have an attached report in your packet, GZ has projected an annual budget for 2025 of $902,000 with a shortfall of $186,000. So I did ask them about that shortfall, and they reported that the shortfall will be due to the end of the city and county grants, along with lowering their tuition rates starting July 1 of 2024. The Children's Trust has invested approximately about 45,000 supports thus far, and those supports are both physical items that they needed for their school, along with capacity building trainings. So they've applied for and received funding from the CTAC Emergent Needs Fund, and GEC is participating in the Business and Leadership Institute for Early Learning, Velocity Masterclass, and Accreditation Academy. Completion of the Accreditation Academy and application for Gold Seal will draw down additional dollars. The children's staff has recommended to GEZ to work with ELC to identify funding categories and resources. If you remember from my last presentation, there are a lot of different funding categories in addition to the one that we would like to start as well. So we've asked them to meet with them to identify of those scholarship children, if any of them would actually meet any of those funding categories, and if there's any additional resources as well. We also ask that they utilize the accreditation specialists to strategize any barriers or challenges as they move through Accreditation Academy to Gold Seal. One of the barriers that I've noticed for some of our centers is staff. So losing and gaining staff, that can be really hard when you're going through accreditation and catching your staff up. So by working with that specialist, they can identify any of those barriers and be able to have a stronger walkthrough as they go towards Gold Seal. We also asked to evaluate how the school readiness rate increase, school readiness plus program, after school programming and future designation as Gold Seal will impact the remainder of 2024 and income projections of 2025. So as I talked about before, the legislation changes, there's a lot of them, and we're trying to understand all of them. One of those is school readiness rate increases. And we also asked to research and collaborate with us on piloting a literacy project for early learning like QFly or ASMINO, fully funded by the Children's Trust. So for this presentation, Gainesville for All will provide an update on GEZ. To better inform the upcoming budget cycle, the Children's Trust staff will be partnering with the Florida Association of Children's Councils and Trusts, that's FACT, and the Early Learning Coalition and other local state partnerships to better understanding the implementation of the recent addition to legislative changes, appropriation to family eligibility, school readiness rate increases, all of those things I just talked about that will take effect on July 1. And we believe that it will provide needed support and sustainability for GEZ and all of our early learning centers within our county. So we're asking that the board receive this report, and we will bring back to the report once we know a little bit more about those changes, anything that we need to change, any recommendations that we would need to make regarding funding supports for families enrolled at GEZ and other early learning centers.
Thank you, Mia. Any questions? Okay. Mr. Lawrence. Good afternoon.
Good afternoon, everybody. It's been quite some time since I really spoke to you guys about what we're doing over at the GEZ Family Learning Center. In fact, it's some 17 months ago since we made a presentation. But I just would like to start out by letting you know, I have a couple of our parents that are here. They're going to speak during the general comment portion of this presentation. But the main thing that I bring forth is, and that we're thrilled about since the last time that I visited, is the fact that we opened. Now, we opened. Yay! Seriously though, that was a monumental challenge to open it. And I do thank the Children's Trust. As Ms. Jones pointed out, you guys have been supporting us along the way. And I'm here today to ask for even more support because we're gonna need it. But I want you to know that already we've been open now for seven months. And already we're making substantial progress. You may have seen news stories just last week, you know, that our assessments from ELC, Ms. White, came in about a week and a half ago, and we're one of 17 providers in the community out of 77 VPK programs that scored high. And so we were really proud of that after just seven months. So, but I want to talk to you just a little bit, and I've been given my instructions, 10 minutes, 10 minutes, so I'll try to get through this in 10 minutes because there's so much to really talk about. And maybe I'll just go through the quick summary. The first thing I need for you guys to understand is the Gainesville for All Family Learning Center, while yes, we are a provider of high quality child care, that is not our mission. That is not our mission. That's a side benefit, and it's a needed benefit. Our mission is to start to close, my good friend, Ms. Tina Certain, work with the school district to start to close or narrow the achievement gap. That's our single biggest mission here. And that's really about the community coming together to address a problem that's really in crisis mode in this community that we really don't talk a whole lot about. You know, our community, and it's not just Gainesville, and you know, as most of you know, I've been an editor / reporter for some 43 plus years. And I've seen a lot and I've done a lot over those years, and all over the country. These problems are the same problems. They're the same problems. And I get the feeling that sometimes think they're intractable. They can't be solved. I don't believe that. I truly believe that, and we know what needs to be done, but we haven't done it. And so what we're doing at Gainesville for All, we're trying to demonstrate that it can be done, and that this project on the east side over at Metcalf is a template for the kind of change that we all have been looking for. It's a template. You know, we're not over there to open up a high quality childcare center on the east side. Side benefit is so much bigger than that. And the vision is that, okay, we're living in a community like so many others that's becoming increasingly polarized racially, economically, and nobody is really looking down the road at what kind of community we're going to see. You know, I probably won't be here, but our kids and grandkids and great grandkids, they'll be here. You know, so we need to be thinking about that. So at what point are we really going to take seriously to try to deal with these problems? And it's been pretty clear for a long time that the way to do that, at least one way to do it, is to get to the families and get to them early as possible. So that's what we're doing. That's why we chose the childcare mode, is to go about it. Our kids start at age 6 weeks old all the way up to 4. And so our immediate goal is to get them ready, kindergarten ready. So when they go to Metcalf or wherever here in the school district, they're ready to learn. And unlike too many of them today who are not ready, some don't even know their real names. So that sort of lays out what it is that we're all about, and we have a strategy to get there. But we need assistance, help to get there. We can't do this alone. We need the entire community to really mobilize and work with us. The school district, as I said, school district has been, school districts all over the country, they've been tasked with doing so much, and they can't do it all. They just can't do it. There is a need, a desperate need for partnering. We need to partner, work together, and that's the way to bring the community in, work together to really start to make some real headway toward this serious problem that is not going away. If anything, it's worsening. So our steps, we've done our accomplishments. You know, you guys have seen our report, progress report. I don't really need to go through all of that. Hopefully you did take a few minutes and read through it. But the bottom line is that our biggest challenge so far has been families are hard put to even those who are receiving ELC. I've seen some things just in the last seven months that are really disturbing. You know, I've written about this stuff, observed this stuff, you know, as a reporter slash editor, blah, blah, blah. But, you know, I'm right there every day, 5 days a week, you know, and sometimes at least the staff is there all 11 hours a day. Yes, we're growing greatness, and that is our motto, but it is a formidable challenge when you consider what these families are enduring, and there's very little help. So it's foolhardy to think that children coming from these families are going to be scoring high on these achievement tests, standardized tests. No, it's not going to happen. And so you can point to a school, well, this is a bad school, that's a bad school, and the kid's not doing well, but you know, there's a reason. And so we see that. And one of the things that we're doing that's not being done elsewhere is the fact that we have a family engagement specialist, a woman in town who has been in this community for quite some time and came to work for us in January. And we're already seeing the benefits of what she's doing. You know, she assesses every family that comes in. You know, she's building trust with those families. Those families are coming to her with the various issues, and thus we're able to make referrals to services out in the community that oftentimes most of the families are totally unaware of, these great family services that are out there. So our approach is one that we believe is going to be worthy of replication, and it's not going to take 3 years, 5 years. We would hope that we could see other facilities like ours in the county in the not too distant future, and maybe around the state, and who knows, around the country. But the need is there, and we're trying to demonstrate how it can be done. And one last thing I would say, the scholarships that we're offering to and nearly 60% of our families are receiving some sort of assistance, whether it's from us or from the ELC or both. On my desk right now, we have the latest count, and it does fluctuate. Latest count is 39 enrollees. And the reason that is because we didn't get certified until 2 days before we opened on August the 10th. A lot of parents had already placed their children, but we did start to see an uptick back in October, and that was mainly due to the fact that we made it public that we're going to provide scholarships. And that's what we've been doing. So the numbers are increasingly have been going up since October. But the deal is that costs us, you know, that we're trying to demonstrate not only that this is the way forward, but also in the childcare industry that, you know, people who work there ought to be able to get health care. They ought to be able to have retirement benefits, and we're providing those at a cost. But now, it doesn't take an Einstein to figure it out. If you got these kinds of expenses and you're lowering your rate, before long, there's going to be a serious problem. So it is because of that and what we're trying to do, and we believe this is the right way to go to move forward, that we need help. We need help from places like the Children's Trust. And I looked at your mission statement and your guiding principles, and I think we all are in alignment with them. So, so with that, I'll close. I'm sure you guys have questions for us, and maybe my parents, you might want to hear from them.
We definitely do. And, but any member have questions of Mr. Lawrence? Member Surgeon?
Thank you. So the slide that was back up there, would you take it back to the scholarship, that slide that was there? It's in my book, but, so what's your criteria for your scholarships? Are you like income based, like when we first started our meeting, we were, well, Mia's presentation about, there was two pots of money, right? There was one if you were like really, really low income, and then there was another that if you were over a certain limit, that this scholarship.
150.
Right, so do you have a criteria, Mr. Lawrence, for the scholarships?
Well, it's pretty broad, to be quite honest. It's need. And probably the word is getting out among the parents. You go in Mr. Lawrence's office and give him a sob story, he'll probably give you a discount. But the deal is that the folks who are coming in, we look at your income, we look at what it is that you have to do with that income. And I can't tell you the numbers of times that, mostly it's mothers, as you probably would expect. They're coming in and they're just in some pretty dire situations. And so I try to fit what they have, what their needs are, then we try to reach an agreement. Well, can you do this much? Can you do this much? And that's pretty much the way that we've been operating. Now I recognize there is a need to have a set policy, but when I step back, the whole point of what we're trying to do here is to reach the low-income families. It's the low-income families where their achievement levels are worse. And so to turn those families away, I don't think that we're doing a disservice. So we need to try to get them in and try to work with them, try to help. Some people have come to us just needing a place to have their kids so they can look for a job.
Right.
So we try to help in any way that we can.
Okay, so
You had another question, didn't you?
I did. I got a couple.
Just tell me when to move on.
Okay, so it sounds like you're trying to serve families that are, I understand the low income. I know that's a given, but
Right.
the Alice families, asset limited, income constrained, but employed. I mean, I was at United Way early, Thursday for their meeting, and they were talking about
Same population.
same population and the same issue with childcare and all of that. So but you got to have a criteria because you are in business. So you got to kind of do what you got to do to stay in control. But I want to go back. You said you're trying to address the achievement gap. And what I really want us to start focusing on, it is really opportunities. Some children don't have the opportunities that others have. And so tell me, just your general philosophy, briefly, what you're doing, that you're thinking that you're giving children an opportunity. Like, what is GEZ doing that's singling you all out, that you're saying that you're going to solve?
Well, first of all, we have a top-notch ELC recommended curriculum, of which we paid some $25,000 for. We have college-trained teachers. Then some of our assistant teachers have associate degrees, or they're working on those kinds of credentials. So we recognize that we want to produce, again, kindergarten-ready youngsters, and we're going to have that come May, as evidenced by our assessments. And I may not have mentioned, we just had another study that was done by one of our students who was at the University of Florida, but it was commissioned by the Lassinger Center. So they're getting involved in terms of performance and performance by our teachers. So top quality daycare is what we're providing as a way to ensure that we have these kindergarten-ready children who are ready to learn, not just for when they get to kindergarten and first grade, elementary school, and onward, but a lifetime of learning, a lifetime of learning.
So your families, are they coming to you, like not with the need, but are they fitting into programs that ELC are funding? Like, do they have vouchers or are they on the waiting list? Like,
Well,
are-
it's a combination. It's a
So-
combination. Right now, like I said earlier, we got 39. Some of them have ELC, some of them don't. We have some private pay personnel that coming in as well. So it's very diverse.
no, so that's good to
Most-
private pay, but you're here saying that you have need. I'm just trying to figure out, like, us to brainstorm to figure out how you can close your deficit and you can
Well-
get people that they.
Well, right
with
now,
assistance.
today, and I check it every Monday, okay, what's the latest count? Today, it was told we have 5 families waiting on our waiting. They're waiting to hear from ELC. They're waiting, talk to me about scholarships and about reducing their tuition rates. So that's where the greatest need is, because there are, I think, if the word really got out that we had the wherewithal to serve, we couldn't accommodate the number, our capacity.
What's your capacity?
Well, our capacity right now is 87. Full capacity is 87, but DCF, they have certified us for 128. The reason we don't have 100, we're not even trying to get 128, because we were cognizant of the teacher-student ratios. NACE accreditation, they have a recommendation of just how many you should have. So that's 87, not 100.
Oh, okay. So in the NACE is what you're trying to pursue to get the gold seal, right? That goes hand in hand.
Well, actually, the standard that we're pursuing is the gold seal through Apple. Is the one that we were working with.
Okay. 87. 7 months, what you learned that you think is gonna put y'all over the finish line? I mean, it's gonna make you be successful, and that's not what you learn, but what can you use, in
Well,
the 7 months?
As I indicated about the families, I think that's the one thing that really sticks out, that we've got to do something about the families to shore up families, help to stabilize the families. It's just unreasonable to believe that these kids coming out of some environments that are not only toxic, but these are environments that children, they just cannot really grow in a way that they should. So what can we do as a community, to get behind these families? And I think there's lots that we can do that's not being done. I think there are a lot of people in this community who really want to do something, but they don't know how to get it done. So we can show the way, funneling through an organization like ours to bring the community together to support the families and the school system as well, because the schools cannot do it alone.
Do you conclude?
I think that's all.
Ken and then Judge.
Thank you, Mr. Chair. James, thanks for being here. I support the mission and the goal. I really have 3 questions. One, with 40 kids, 24 are paid, 16 are under scholarship. Have you figured out how many paid you really need to be break even with a capacity of 87? What's the number?
Well, the number is we need $952,000 to operate next year. We have an external accountant and an internal accountant. Unfortunately, our internal accountant, she could not be with me today because she hopefully she does not have COVID, but she's wrestling with something. But she is our budget person, and I even had hoped that maybe she could call in and answer some of those budgetary questions that you and others on the panel might have. But the individual cost per I don't have that with me, but I can certainly get that.
Okay, second question, private fundraising, where are we with that? What's your anticipated of the 952, how much are you anticipating getting through private fundraising?
Well, we have a whole strategy here. It's in the report of how we're going to pursue the additional monies, and we're talking about at least $186,000 that we need additionally to what will come in the year 2025. Some of the strategies include, of course, grants from foundations, from both locally and nationally. We were approached, Ms. Kiner, last week or so with the Leadership Gainesville, and we were talking about a major fundraiser that we would like to do in the fall. We've had some moderate success back in 2022, where we actually did one-on-ones. I had a team of people working. We visited people of means in the community who gave pretty liberally to help us fund things such as the renovations to the school, which is, we spent like 150,000 there, and then 127 for our playground. And much of those funds came from private individuals locally who gave. Those are the primary ways that we're looking at. Of course, the county, the CAP program, we're still waiting for specifics for how we can apply, but we've been told that we should be eligible for county assistance. So we're going back to the county with that. So we have a list of about 6 things that we're actively pursuing, and we're not just sitting around twiddling our thumbs.
Okay, last question. In your report on page 146, you talk about the child care cliff that's facing the state. And what I interpreted that page to mean is that there are childcare providers going essentially out of business.
Yes.
Have you had an opportunity to, I'm reminded of a situation where Hutch with Animal Services a decade ago got with some of the providers and said, y'all need to combine because you don't have enough
Economies of scale.
yeah, economies of scale to provide. Have you had any discussions with some of the providers around your location to see if perhaps they could combine with your organization for not only personnel, but also kids?
No, we haven't had those kinds of conversations, but we have had conversations with parents looking for places for their children after suddenly being told that the provider was shutting down with hardly any notice. We had one just this last week. He had 3 children, and she went on a Wednesday, and the provider said, we're shutting down on Friday.
Okay.
Boom.
Okay,
So,
thank you. I have one question for Mia and then I'm done, Mr. Chair. So Mia, we had this whole discussion about the child care tuition assistance, and you said we've identified 186. Have we linked any of them as a potential opportunity for Gainesville for All with those kids?
So that was one of the things that we asked of Gainesville for All to, or GZ to really meet with, ELC to determine, number one, do any of their scholarship children even, are they even
Existing
on the
foster
wait?
business, that's what I was asking.
So that was one of the things that we did ask that they do. And then, of course, as Ms. Certain had asked, looking at the criteria that they've set, would it even meet the criteria that we have set for that, for that new program?
Okay, well, that is my ask, Mr. Lawrence, from me to you, that your staffs this week get with the ELC. There's 186 kids. You need to, I mean, you're adding 3 or 4 a week, best case. Spend the time and see if any of those kids are eligible, because the trust is finding money to fund them, which funds you. So that would be my ask. Thank you. Thank you, Mia. Thank you, Mr. Chair.
Madam Judge.
Thank you. Hi.
Hello.
Thank you for being here. A really great report and certainly a lot of good information. You probably haven't spent a lot of time with me, so you don't know what my normal asks are, but here they are. Do any of you, do your providers, I know that you're licensed through DCF, do any of your providers, have you taken any training on trauma-informed care?
What, I'm sorry.
Trauma-informed care. There's several different classes through DCF that talk about trauma-informed care for childcare providers, program directors, professionals, and I just feel very strongly about people that are having children with them have some level of being informed about children's trauma. And you talked about wanting to work with families, and I just see a lot of kids that have families who've had trauma and who have had their own trauma. And in this setting, trauma doesn't necessarily mean, someone's been killed in front of them. It could mean that their family went through a divorce or, there's just lots of different things. And I was just wondering if you all had looked into that at all.
As I kind
If you
of
haven't, would you?
as I indicated earlier, we do have a family engagement specialist. And that's one of the things that she has been doing, making referrals to outside agencies who can provide that kind of care. And I know of at least 2 or 3 situations where Trish White, who's our engagement person, has gotten involved in situations where trauma care was necessary.
It's beyond just getting help for people. It's about knowing how to react to a child who's coming to you with
Right.
something that you see a behavior that you may think maybe this
Right.
child's bad, but the child's not bad. The child's
Right.
having a reaction to something. So
Right.
I was just wondering, I just Googled trauma-informed care for child care professionals. DCF has 3 different programs that you all could take, and I just think it might be valuable to look into that.
Yeah, well, I would speak to her about that and how we can get involved in it.
I'll send Ms. Kiner and Ms. Goldwire
Okay.
the link.
Well, and one thing I'll say, I've worked with Trish over the years, like probably the last 15 years on and off, and she has expertise working in the DV
Yes.
system. So I know she has expertise in that. It's just how that's maybe being shared with the other teachers or.
She may be the right
You're-
person then.
Right.
Talk with them, sure,
Right.
but
Right.
I would
Right,
want
but
more than just her.
I would think she understands, because I've even
She
gone
does.
through
She
her
does.
DV classes where she taught.
Hmm.
And she's very attuned to that, but you've
Chair.
got a good
Mem-
staff person in her.
Yes, I know that.
You do.
She is good.
Member
We're
Chance,
very fortunate to have her.
Member
Uh,
Chance.
Thank you. On sort of a related topic, and I wasn't here 17 months ago, so this may already be happening, so forgive me, but is there collaboration with who I would consider, from my point of view, kind of a sister center on the other end of town at the childcare center? And are there any opportunities for shared back office services or just on the overhead side or the training side for that matter?
Well, we have not been involved in terms of working with other centers. It's not that we're opposed to doing that. We're most certainly open to it. And in fact, I visited with one of the childcare centers on the west side just several months ago to talk about what we're doing and perhaps what we might be able to do together. Those conversations never continued. And quite frankly, we have just been so busy since we opened in terms of hiring, in terms of all of this is relatively new well, certainly to me. I'm a journalist by trade, so I'm learning all about the child care business. But the good news is that we have found good people like Trish, to help in the day-to-day operation. So we have been shoring ourselves up. So before we go out to say, okay, let's start to work together. So once we can identify the weaknesses that we have and where others might be able to help us out, then I think it'd be an appropriate time for us to pursue those kinds of partnerships.
Great. Thank you.
Any further questions? as I understand it, it's staff's recommendation that we give y'all time, Mr. Lawrence, to get some information and for y'all to get together and at some point, bring us back something telling us how the discussion is going. Is that correct?
Certainly, we are
That-
working with Mr. Lawrence. We have committed to continuing our discussions, our meetings. We wholeheartedly support what G and Z is doing. So yes, sir, we will continue to see how we can partner and support.
And they're currently enrolled in the program where
They
when
are
get
in the
certification,
Yes, sir.
then they can get, potential is there for increased funding through the state.
Yes,
Is that
sir.
correct?
Yes, sir.
Okay, all right. Well, Ms. Lawrence, thank you very much.
Okay,
And
thank
we
you
wish
all.
Best of luck.
Thank you,
you know,
Jay.
And we can't wait to hear from you. And I believe there were some family members that wanted to speak. So, this would be the perfect time. And thank you for your patience for being here, as long as you've been here.
I actually really appreciated sitting as a parent, listening to like how the monies are discussed about our kids and stuff like that. So it was kind of nice to sit in here and listen to all of that. My name is Brandy and my two children attend Gainesville Empowerment Zone Family Learning Center. It took me a long time to actually take my kids and put my kids inside of a daycare center. The way that my family was brought up, we don't put our kids in daycare. The grandma raises the baby until the baby gets a certain age, and then you send them off to school. Well, I moved up here to Gainesville with no family. All I have is my children's dad's family. So with the things that I've gone through as a young mother, I found myself in some really weird spots. There was this daycare that I saw, I liked it, I went in there, I toured and everything. I was like, oh yeah, sign the kids up. The day before I go to take them to school, the daycare calls and tells me that, well, ELC, they discontinued their relationship with them. So I was already saying, Lord, with ELC, I barely can afford the tuition right now. So I know, I got to find somewhere. I found somewhere on 13th Street, signed the kids up there. I kind of felt like my baby had like a behavior issue there. I was always getting called from work and, I needed the daycare so I could go to work. But if I can't go to work, can't pay daycare, so the whole lot of stuff started happening. So, my children's father, his grandma was like, oh, I know this house daycare. She takes ELC. You can send the kids there. It's not that many kids there. So I felt comfortable with sending my kids there because they're going to have up close and personal, engagement with the teacher. Not that many children. So I'm not that worried about them getting sick and stuff like that. The house daycare was good, but it really was just that. It was like a babysitter.
Mhm.
There was not much, there wasn't much learning going on. It was like, okay, she dropping off, she watching for the day, and that's what I have. My VPKer, he went from Lake Forest Elementary to Metcalf. And he only went to Metcalf because 2 days before school was supposed to start, the school called me and was like, oh, well, we don't have a spot for Legacy. So now I'm running like a chicken with my head cut off, like, where's he gonna go? Oh, Metcalf, they don't have VPK, they don't have VPD. Rollins, they only do disabled. So I'm like, oh my God, what am I going to do? So I went to, it's on the west side of town. It is called, oh goodness, I can't think of it, but it's on the west side. It's the Swag Center. I went to the Swag Center and the Swag Resource Center said, I was on Gainesville Word of Mouth and I saw this daycare, Gainesville Empowerment Family Learning Center. I was like, okay, I'm check them out. I called, I asked them, how old they take up to 4-year-old, and I was fine because Camden is in kindergarten now, so I don't need the 5-year-old, got the 4-year-old. So, I put the 4-year-old in, but I did not take my 1-year-old and put my 1-year-old into the center. Why? My 1-year-old, Lord, he is violent. And like you say, trauma, children definitely, like my kids have been through a bunch of trauma. I thank God for the people that are at the Gainesville Empowerment Family Learning Center because when I first put my Legacy in, I was like, oh, okay, yeah, I like the teacher. Yes, she cool. They do, they learn. He's learning how to write and stuff. I can hear the difference in the words that he's using, the way that he's expressing himself. I can tell the difference. And so I'm in there, y'all see, I like to talk. So I'm talking to the people and every day I talk to them. I get out talking in the morning. I get out talking in the afternoon. So I kind of got very acclimated with the teachers that were there, the ones that were my son's teacher and the infant teachers as well. So then one day I walk into the schoolhouse and I say Grand Rising. I don't say good morning, I say Grand Rising. and around the corner flew the new infant teacher. She was like, I knew it was you. She was at the first daycare that I put the kids in on 13th Street. She was like, oh, I've been waiting for Braden, which is the baby. I was pregnant with him at the time. And she was like, I've been waiting for him. I was like, oh no, he's at, the home daycare. I'm not bringing him here. I wasn't ready to bring him because Braden hits, he hits. And you watch the news about how infants and babies get beat on and hit on and stuff. And I just was not comfortable with just sending my child just anywhere. So I decided to say, okay, I'm going to send Braden. Y'all, when I sent Braden, y'all have no idea. When I say my children and I've been through trauma, I know Miss Trish White very well. Very well. When Miss Trish came out that office, I just couldn't do anything but hug her. I hugged Miss Cartwright. I said, y'all bought Miss Trish. Oh, like y'all really did something, because when I told Miss Cartwright, I said, Miss Cartwright, Legacy suffers from depression. Sometimes you'll see him, he'll go off by himself. He don't want to sit with nobody. He don't want to talk, and it's best to like pull him in, give him a hug or ask him what's really going on and stuff like that. And they like the stories that they tell me to keep me updated. Like they were reading a story and my baby was interested in the story. The kids kept talking and he just went and stood and looked at the wall. And she pulled them over and was like, well, Legacy, what's going on? She said, I want to hear the story. He said, I want to hear the story, but they keep talking, and that right there made me feel good because she actually paid attention to that. You get other places where they just let the child go off by themselves and stuff like that. But I am very open. I am a domestic violence survivor. So when I told Miss Cartwright them that, please keep an eye on my kids, on my baby. When Braden, the first day he was there and I came back, I'm signing the incident report because Braden did exactly what I thought he was going to do when he got to the schools. He is hitting, and he's one and doesn't know how to express himself the right way. But to have him in the environment that he is in, to where he is expressing himself that way, but they're teaching him the right way on, we don't hit. And he do go to timeout, he needs to go to timeout. But that's stuff that they're doing there. And I really appreciate it. Like I'm watching my baby's penmanship get better and better as he gets to school. He's ready to go to school. My 5-year-old actually, he said, oh man, I hate it because he wants to go so bad. He wants to go. I've had times where Miss Cartwright and them, I asked like, can Camden come for 30 minutes? I'm getting off for late from work. I was working at a retail store. You don't always get off any job, you don't always get off right when you're supposed to get off. And because Camden goes to Metcalf, he was able to go there, get his homework started by one of the teachers that were there. That is something that I really, really, really love about this center, because when he says like family oriented, it makes me feel like you guys are family oriented. Like what me and my kids are going through, for you guys to be right there on my side, it makes me feel good that I don't have no family. I don't have nobody up here. That's all I have. So if I'm going to work, I want to send my kids to an environment where it's positive, where the teachers, the parents, all that, it just makes me feel good. So I wanted to come out and say that to you guys on behalf of Gainesville Empowerment Zone Family Learning Center, because I think that this is a great community for the children great place for the community to have for the kids to go to, and starting all the way from, 6 weeks old to, 4. And if they could get it to 5 in the after school program, I would like that too.
Well,
But that's all I had to say. Thank you guys.
Thank you very, very much for staying, and we appreciate it and good luck. And it's a shame that you just aren't very enthusiastic.
And to that point, Mr. Lawrence, I think you found your fundraiser.
And if not, she would do fine for a cheerleader.
Would you give this to Mr. Lawrence?
Yes.
Thank you.
Thank you very much for coming.
Yes, sir. You're welcome.
We appreciate it.
Thank you.
Thank you.
Okay, anyone else?
What a brave woman. She's going to follow this.
With a guest.
I am also a parent. This is Miles.
Miles.
I am not usually the public speaker. I get very nervous. My husband usually does this, but I did wanted to come out and talk about Gainesville for All, because my son has been to, this is his 4th daycare. And this is the first daycare that he is actually excited to go to. Like just now when I told him, hey, I'm going to a meeting, he's like, where's your meeting? I'm like, it's at your daycare. He's like, I'm coming. I'm coming again. And I'm like, and he don't usually, he does not like to go anywhere. So Gainesville for All is really a family. It's really a center that you can see that they really care. And you don't see that you don't really see it a lot it's a lot of it's a lot of daycares around Gainesville, and you just don't really see the care anymore, honestly. You know, people see money. People, the kids gotta go somewhere because they gotta go to work. So, Gainesville for All, they actually sit and they pay attention to the kids. They teach the kids, anything that is out of the ordinary that they see with my child. Usually they always tell me after, and I'm so thankful that they pay attention the way that they do. Yes.
Well, thank you very
Thank
much. And
you.
thank you for bringing Miles as well. And, there are many different ways of public speaking, and I think you did an excellent job.
Thank you.
Anyone else? Okay, all right, well, we'll close this and then, we look forward to hearing, what y'all come up with. And next item would be general public comments about anything anybody wants to discuss that wasn't on the agenda.
Hi there. My name is Christy Arrington, Executive Director of Girls Place. Dion has a lot of power over me in the next 2 weeks. But I did want to publicly thank him. Dion said no to a lot of things over the last 3 years. He wouldn't drive a van. He wouldn't coach basketball. He wouldn't just miraculously complete paperwork for me. But what he did do was absolutely advocate for us as an organization. So thank you, Dion. I appreciate you, and I will continue to try to embarrass you in the next 2 weeks.
Thank you, Chrissy. Anyone else? Okay, yes, ma'am. Be careful you don't step on your glasses
I
on the
know.
way back
Thank you.
or sit on them now.
I'm Elizabeth Gadsby from Gainesville Thrives, and I also likewise would like to show my appreciation for Dion. He has helped us and guided us, and for the entire Children's Trust, what you have done for us and allowed us to serve the children and help them love reading. So thank you.
Thank you very much for coming up and expressing gratitude to Dion. Think. Anyone else? Okay, board member comments.
One question. Dion, when's your last day? I'll try to bake you something. I ain't making no promises, but you know.
Whoa.
Will you be back in the office though? I mean, your last day at work is what I'm asking. Briefly on this. But you're in the office the rest of the.
Oh, and that's why Christy's looking so sad. She just gave up every sign.
Listen,
Reality hits.
Christy might need baked goods at the next board meeting.
You
Any-
can treat too, okay.
Any board comments other than Nancy? Mary?
I'll
Kim?
say just goodbye to Dion too. I thought all of the staff, but I was so sad that you were leaving. I'm happy for you. You're going to get to do something that you're passionate about and be back with perhaps family, but it's a real loss for us. And so I'm thankful for what you've done for us and I wish you well in the future.
Ken?
Thank you, Mr. Chair. I'll just say that the county's starting their budget prep. I know we're starting our budget prep. And I think what the county is looking at with inflation being where it has been and continues is compensation adjustments in the 5% range. So I just wanted to let you all know and let Marcia know. I don't think I've told you that. I don't know where we'll end up, but inflation is still high.
There.
Yep.
Sure.
No, just same, I'll express, thank you guys. I can't believe we're losing 2 people at once.
I know.
And thank you for all the work you guys did with the workshop, because that really, I love that process and that we're making decisions right there and you guys came back with everything. Thank you
Great
for all the
job.
work with that.
Dion, I'll miss you on, from here, but I also miss seeing you at the gym too. So you are my inspiration, get in there and get it done. And Diana, thank you very much for everything. Appreciate it. Your spoken demeanor is very much appreciated and all the hard work. You know, you quietly put up with all the, all my BS, and all my questions and you were always very kind and I appreciate it very much. So it is a loss, both of y'all very much and y'all help make the organization what it is today, which is, light years ahead of where it was, when it began. So thank y'all very much and we appreciate it and can only wish you the best of luck in the future. So, thank y'all very much. And with that,
Nope, one more thing. I just wanted to briefly give you all an update. I heard from.
that is not on the agenda.
Yes, it
Oh, okay.
I had an opportunity to hear from School Board Chair McGraw. She said that they are still working through the budget, but she believes that the school board will be able to come in at 50,000 for the literacy plan funding. So I just wanted to keep you abreast of what I'm hearing. And once I hear the final amount, I will bring that to the meeting. That is
Thank
it, Mr. Chair.
Thank you very much. And with that, this meeting is adjourned.
Most of the county has already agreed to split